Crystal. I am the Executive Director of the Lake Area SART team, and I'm also the Director of the Lake Regional Forensic Program. I want to tell you a little bit about the program and talk to you about the services that we offer and kind of show you the space that we have designated here at Lake Regional for our victims that undergo sexual assault and present to the hospital for an evaluation. So when a patient presents to us, they come to the emergency department most of the time. They get checked in, and then our forensic nurses who are on call 24/7, whoever is on call responds to the hospital, greets that patient, and then works with our multidisciplinary team to assist that patient through their victimization. Members of the multidisciplinary team include the advocates, which would be through Kids Harbor or through CADV. They also include law enforcement. We work very closely with all of our local tri-county law enforcement agencies, and then it also includes members of the prosecutor's office and also children's division. So when that patient has been triaged, all of us respond to that patient at one place, one time, and then the patient is brought down to this forensic area. As you can see, it's a little bit less sterile. It actually has a little bit more of a homey feel to it, just so that they don't feel like they're in a hospital and probably can relax a little bit more. So once we have interviewed our patient, then we go to the exam room. I'll walk you down the hall. This is the exam room that is completely for forensic patients. This space is designated for forensic patients only. So they have a private exam room, and then they have a bathroom and shower, and then we have the ability to give them a clean outfit, clean underwear, all of that they might need following their assault. Everything that we do is victim-centered. We are all trauma trained, so the priority of our exams are not just to collect evidence and help prosecute this case, but also to reassure these victims and to help them get through the trauma that they have recently suffered. Oftentimes, it is very difficult for them to come forward and to talk to us about what has happened, so we want to support them and encourage them whenever they do present to us. So we feel that this is a great way to initiate that, showing them that we have the resources to give them that private space just for them. This over here is our colposcope. This is what we use to do microphotography. So anytime anyone has been sexually assaulted, there might be things that we can't see with the naked eye, and we use this camera with basically a microscope on it to look for those injuries. And then we have special drying racks for when we do actually collect evidence, swabs, whatever it may be, just to kind of help preserve whatever we're collecting. And then we work really closely with law enforcement to get that to the crime lab. And then once that comes back, we work really closely with the prosecutor's office to move this patient's case forward. Our case doesn't end when the patient leaves our exam room. There's follow-up that we do. Additionally, we go to court with them, we advocate for them, and oftentimes we testify on their behalf as expert witnesses. So it is a full forensics program here at Lake Regional. We do more than just sexual assault. We do domestic violence, sexual assault, abuse, neglect, and any kind of an aggravated assault with a weapon. So if someone's been stabbed or shot and it was done maliciously, those are all cases that we help work with. I'm very proud of Lake Regional's support for these victims and all of the resources that they've given us to assist these victims. It's been instrumental in the cases that we see. It's been instrumental in helping us move forward and expand the program. And we appreciate any support that you would give to us through the raffle.